listening to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. We are heard on Talk Radio and iHeart, and we are also a podcast on Spreaker, so look us up on those platforms. Jeannie Rose, my co-host in Indiana, and I am in Florida. Jeannie, today we want to do some what you call housekeeping. We want to follow up on some topics that we were talking about on previous podcasts. So let's talk about that. One of it is about the insurances, different payments, stuff like that. What do you got?
Well, one reason that people cannot get into doctor's appointments easily is because a lot of doctors' practices, hospitals, whatever, they cut back on the number of Medicare, Medicaid patients that they will see because they can make more money from patients who they are seeing that have private insurance. So a lot of times, especially Medicaid patients or whatever your state's funding is called for Medicaid services, they have a rough time. And it seems like some of the cities that have the higher concentration of Medicaid patients have the fewest number of doctors available to see, which is really sad because then that forces them to go to clinics or not even get medical care because, physicians want to make money. The hospital systems want to make money. So they are going to see the people who can pay the most for their services.
Yeah. And we're talking about Medicaid, not Medicare.
Well, Medicare, they also limit the number of Medicare patients too, but more so Medicaid patients.
Well, they get paid less, way less.
Yeah. And, and you would think, because people talk about socialized medicine, that socialized medicine wouldn't have the same issue, but I've talked to numerous people from the UK and from Canada, and that also kind of holds true with them. Their wait time to see a specialist doctor may be, I've heard one person say 3 years.
Yeah, I've heard some similar. Yeah, I've heard similar.
Yeah.
But that socialized medicine, from what I've ever talked with, and of course we can't talk with everyone, didn't seem to be adequate care, where a lot of the people from Canada came to the U.S. to get medical care. Yeah.
Right. And that's true. Wealthier people in the UK, Canada, they actually can go to a different hospital system or whatever you want to call it, because they don't have to partake in the socialized part of the medicine, or they come here for their treatment.
Yeah. That works. The same thing here in the U.S. I know many people that are billionaires, and they get to decide where they want to go. They can go to Mayo Clinic just for argument's sake on a whim if they want to go there because they have the money and the means to travel there and stay there. So same deal here, except across the board, in my opinion. And again, this podcast is all our opinions and our research that we do. We're not doctors. We're not lawyers. My opinion, can still get decent care here overall.
Yes.
You can.
Right. Which, Cindy, you sent me an interesting article about what I call a pilot program in Florida involving Medicare. And I thought, they're going to monitor it to cut down on readmissions, on adverse events, but it was my understanding that they already do that hospitals, doctors, they earn bonuses or not based on if they have a certain number of readmissions, if there's an adverse event, even if a patient doesn't follow the medical advice. So, I know a lot of the surgeries like hip replacements. I know someone who recently got a hip replacement and they are worse off than before they got it.
Yeah. I've heard that sometimes. Yeah.
Yeah. They had a blood clot. They went to the hospital's ER and they were told that the medicine that they needed, they couldn't get it. They went there on a Thursday. They couldn't get it until a Saturday. It's like, whoa.
Yeah, that's pretty.
A blood clot is, yeah. A blood clot's not something you want to wait around on. So I can see that even though we currently have a similar program, how maybe beefing it up could be better, because to me, there's an awful lot of adverse side effects going on with a lot of these procedures that older people get. I know someone who had a knee replacement. She was in her 70s, and the knee replacement part was okay, but she got a massive infection, bone infection, and died within 6 months. So, she was in and out of the hospital until the time that she died. So I can see where Medicare probably does need to do a little more than what they're doing on making sure that these events do not happen.
Mm-hmm.
It's just, I don't know if it will work or not, because I don't know if it's working now. It does. Maybe it's not.
Yeah, I don't know. It was called the TEAM approach, TEAM, and it's an acronym. And I'm not going to remember off the top of my head. I read the article this morning off the top of my head what it stands for, but it talked about the aftercare, especially for geriatric patients, for older patients, and it talked about having more communication and also more availability with the communication across the board. And I'm like, well, haven't we talked about that? Not laughing, but that's what we've been talking about all along. When you don't have the communication, I mean, so I'm with you, Jeannie. Why is this a new concept? It shouldn't even be a new concept if I'm reading the article correctly. This should be the way it just is. I mean, so.
Well, yeah. Well, in the communication thing, when you're in the hospital, you don't see your own doctors. You see their staff. And it seems like then when you go to your doctor, they're like, oh, well, we don't have this information.
Right. Yep.
And so, yeah, there does seem to be a lack of communication that would possibly, make poor results for patients if people are not communicating. A lot of times people are discharged and they really don't know what to do.
Right.
After
they don't.
They're discharged.
Right. And that article says that. And you know what? I want to bring that too. When I went to my own primary care doctor in last October, November, something, I couldn't get in because because they weren't going to give me the appointment that I needed. They told me to instead go to an Instamed clinic. And that was what I said to them. You're sending me to people that have never met me before, and they have to quick on the uptake, know everything there is to know about me to treat this one thing, and I've been going to you for 6 years. Now, this doctor is part of a conglomerate organization. I'm not going to mention any names, certainly, but I challenged the doctor the next time I saw that doctor. How is this considered good care? When days gone by, they eked you in and did whatever, even if you waited in the waiting room for a half an hour, 45, an hour, 2 hours, whatever, to see the doctor, you were seeing your doctor who knew your history. So there's the communication out the window right there. And this is a big box facility. So I'm not buying into it. And now Medicare is writing this article that I stumbled across online. It says that this is what we're going to do. It's our TEAM approach, TEAM approach. I'm like, that should have been that way all along. Why are we really having this conversation? So you're admitting something's been lost in the works all along. And why, again, not to be on the soapbox that long, when you get to Medicare age, because Medicaid is any age, but Medicare age, that you have to jump through this many hoops to try to get yourself good care when you should have been getting it all along, and now all of a sudden, or hopefully you did get it all along, and now all of a sudden they're dropping the ball on this. So why does a 65-plus-year-old person need to deal with this and with the money that's been paid into Medicare all the years that you've worked? Those type patients should have stellar care from the get-go, in my opinion. On that note, stay listening to Evergreen Media Network.